you doing? Welcome to iCare. I'm Dr. Calderon. I want to tell you a quick story about a young Bronx mom who inadvertently ended up saving her son's eyesight for life. Now, this is something that happens all the time, and so I think it deserves a little bit of attention. So let me take you into my office here. So basically what happens is a young mom comes in. She had 3 children. She came in with her 2 oldest because they got a note from school or something like that, and her youngest actually was just along for the ride, essentially. Her 2 older children were fine, and the youngest ended up being the one that had the problem. Her youngest son ended up having refractive amblyopia, which would have left one of his eyes functionally blind for the rest of his life. Now, I'm going to explain that right now, so check this out. The condition is called amblyopia. It's vision loss without obvious organic cause, and it's also the top cause for vision loss in kids. Now, parents can't tell there's a problem, and that's why this is so dangerous, because your child is going to look totally normal. Okay, they'll also function normal, and they can, because one eye can be 20/20 and the other eye can be legally blind, and there's no way that you would know as the parent. And we hear this all the time. Parents will come in and I tell them that their son or daughter has amblyopia, and they're shocked. They say, how would I have known? I had no clue that there was a problem. This is a drawing of the brain. The eyes are connected to the brain by nerve fibers, and at birth the visual pathway is not 100% developed. It actually takes years of clear vision to make these visual connections to the occipital lobe of the brain, which is in the back, and that's where the vision is processed. Now, there's a whole host of reasons why vision may not be good in one eye versus another. There can be cataracts, there can be strabismus, there can be a high prescription, but the result is the same. If there's poor visual input in one eye and the eye is still developing like in a young child, the visual pathway does not get created in the affected eye. And if it's not corrected early on in life, those pathways will never develop, and they'll effectively have a legally blind eye forever. But there is hope. What we can do is we can occlude the good eye and force the poor eye to make those visual connections. The only problem is that we have to do this early on in life, and we have to start therapy early on in life, because the longer we wait, the poorer the chances are that we will actually get good vision out of that eye. Crazy, huh? Well, the reality is there's only one way to make sure this doesn't happen to your son or daughter, and that's to make sure that they get a comprehensive eye exam with a doctor of optometry like myself or a pediatric ophthalmologist. We're conveniently located at 2742A East Tremont Avenue, Bronx, New York, near Westchester Square. All month long, we are giving away free vision screening to your kids. All you have to do is like our fan page and then come in to tell us that you did so, and we will give your child a free screening. That's it. We look forward to seeing you soon.